If you're exposed, do you need to get tested right away, even if you're showing no symptoms?
Well, basically, I'm reading from the CDC website, and there are three groups of people as far as the protocols of being exposed. The first group is, it has the people that are not up to date on their vaccinations. They've not been vaccinated properly. According to this, if you've had close exposure, and that includes within 6 feet for up to 15 minutes within a 24-hour period, and this could even be divided where it's 5 minutes on 3 different times, but if there have been 15 minutes within 6 feet within 24 hours, you have to stay home for at least 5 days in quarantine and then get tested after 5 days before returning to the work site. Now, this is according to the CDC. Now, if you were exposed and you are up to date on your vaccinations, then there's no quarantine. You just watch for symptoms. Now, if you develop symptoms, go ahead and get tested. But if you've been vaccinated, you can resume as you were. It would be advised to wear the masks, though. And then there's the group, if you were exposed to COVID-19 and had confirmed COVID-19 infection within the last 90 days, no quarantine unless you develop symptoms. So this is one more reason why it's so important that everyone get vaccinated. And if you're eligible, get that booster as well.
Yeah, you kind of explained kind of the CDC guidelines right there. If you test positive, even after spending 5 days in isolation and you no longer have any symptoms, then what do you do after that?
You can return to the workplace. According to the CDC, if you want to get tested, you can, but you can return. You don't have to get another test if you don't have any symptoms and no fever without any fever-relieving medication. Now, as far as when you return, it's not necessarily from the day you test positive, but it's from the day you develop symptoms. That's when day 0, that's when you develop symptoms. 5 days later, that's when you can return. So let's hypothetically say that someone develops symptoms. They're very ill, runny nose, cough, sore throat, whatnot, and then they get tested 2 days later. You still go back to the first day when they develop symptoms, and that would leave you with your day 5 where you can return wearing that mask if your symptoms have relieved and you have no fever with no fever-reducing medications.
There is news, Dr. Quinn, about Deltacron, which refers to a merging of the two variants, Delta and Omicron. How common is this?
Well, let's not everyone get excited right now, because I've done some research, and this Deltacron variant that everyone was worried about over the weekend has just blazed the internet, all the social media sites. It seems the researchers are saying it most likely was a lab error due to contamination. Now, it is possible for two variants to merge if someone were to hypothetically get infected with the Omicron variant and the Delta variant, which is possible, and the two variants are within one cell multiplying at the same time. It is genetically possible to have such a variant that's a combination of two variants into one. But this particular scenario that they think that they identified, they are now saying that it most likely was a mistake, but it's still under investigation at this current time.
Okay.
And similar to Flurona, a combination of the flu and the coronavirus, so what can you do to protect yourself from this version?
Man, I'll tell you, we've actually had a lot of patients that have had flu and coronavirus. Now, at our clinic and most of the clinics in the United States, if you go in with symptoms of runny nose, sore throat, cough, well, these are symptoms of someone that could typically have coronavirus or flu. And what we typically do is test for both. Now, there is a test that we have where you can test for both with one nasal swab, and you use the reagent, and it'll tell you if you have coronavirus and the flu or either or. And we are having some people that have both coronavirus and the flu at the same time, which can be very harmful to a person because now their person's immune system has to work double hard. It's double the threat. So it's so important that you get your flu vaccination, get your coronavirus vaccination. You can do them on the same day, according to the CDC. And if you get sick, go ahead and get tested. because the Tamiflu for the flu is very readily available and very effective if started within the first 2 to 3 days. So let's just get tested, get vaccinated, and know that we're going to get through this pandemic.
All right, so always good information. Dr.
Always.
Timothy Quinn, thank you for your time and giving us, clearing some things up. There's a lot of confusion still out there.
Yes, sir. Thank you for having me.